Hello, everyone, and welcome to another audio podcast edition in the Storm Robotics production. As part of Storm Robotics production, this is the Shientist, and this series is about the equity intermission. And first off, I'm going to be talking about health inequalities, and I'm going to look at this subject focus by sort of highlighting works that has a sort of a collaborative effort between the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for kids, and where sort of authors or collaborators the looked at health inequalities in context of long-term conditions or long-term health conditions and health inequalities, and looking at kidney care, nephrology care or kidney care for all, in support of World Kidney Day 2022, which took place in March 2022 this year. And I'm going to provide provide an overview around this work. And before I do, the works will be has been peer reviewed and it has been published. It has been put forward for potentially to present this work at a particular conference remit. However, the works again have been published in a peer-reviewed journal from a collaborative perspective on this. And so I'm going to provide a context in sort of an overview way. So to begin with, a bit of introduction around this work and some aims and some objectives. So, and apologies in advance if some of the context has been heard in some way before. However, this is works that has not been highlighted from a health inequalities perspective before this. A bit of introduction on this focus. So it had been reported that patients with long-term conditions, or LTCs, account for around 50% of general practitioner appointments, 64% of outpatient appointments, and around 70% of days where they may be admitted and staying in admitted into hospitals and staying in hospitals for particular procedures. Around 70% of total health and care expenditure, at least in the United Kingdom, is attributed to people with different health conditions. Education and consultations through online spaces where patients have access or can have access to peer support, and through where there's access through allied health professionals, or AHPs, involvement would help prompt smarter care. Now, providing chronic kidney disease patients, or CKD patients, in this context, education that is centered surrounding clinical and non-clinical scenarios is important, owing to the changes in health and disease over time. Now, health professionals are prompted to keep up to date with aspects of aspects that surround those patients, or those people who are at risk, suspect or high risk, and consult sort of nephrology guidance where most applicable. Now, a stance has been needed or has been required where health educational interventions where health educational interventions constitute a service, equality and improvement. Now, in sort of relating to this, I'm going to highlight some particular sort of definitions around this work as well. So, healthcare is best when there is a position to deliver, when there is a position to deliver at least in some contexts, the National Health Service or NHS long-term plans aim to for triple integration, and what that means is where there is an effort in linking primary and specialist care services and in across physical and mental health services, and especially if connectivity is unified through, for example, apart from the NHS or the National Health Service, also through what's known as the Health and Social Care Network, or HSCN. And this can allow interconnectivity in healthcare that meets compliance. Now, HSCN should allow sort of that untapped area focusing on education and provision surrounding disease trends through e-health or electronic health. HSCN provides the underlying network arrangements to help integrate and transform health and sort of areas around social care services by enabling sort of organizations to access and share information more reliably, flexibly, and more efficiently. Now, I'm going to talk a little bit about the aims of this work in context of the collaborative effort. So the aims were two primarily. So to identify whether whether patients with chronic kidney disease would like to approach health professionals and patients through online consultations and educational support, thus prompting sort of collaborative efforts. And number two, understand if and whether chronic kidney disease patients would welcome more integrative support from healthcare professionals through social media, and wherein patients and professionals can bridge gaps across health inequalities. So those were the two main aims of this work. Now I'm going to talk a little bit about an aspect around health complexity, and the health complexity aspect does link to a little bit around what had been mentioned in the introduction, but to add some more sort of understanding in this context is what I'm going to do. So healthcare complexity. Now, an estimated 15 million people in the United Kingdom have at least one long-term health condition, with prevalence of cancers, chronic kidney disease, and other conditions, for example, cardiovascular, and also including some diseases or conditions around immunology and hematology sort of rising most quickly. So it is predicted that the number of people with long-term conditions or health conditions will sort of remain relatively stable over the next 6 years or so. However, the number of people with multiple conditions or multiple long-term health conditions where they have more than one, for example, and where terminology is referred to as multi-morbidity, is set to rise from 1.9 million from 2008 to 2.9 in 2018. This consequently has an impact on health and lives. Already, the 30% of the population with long-term health conditions account for, again, in some contexts, around 70% of the National Health Service spending. Now, reducing people's dependence on health professionals in some contexts and increasing sort of the sense of control and well-being is a more intelligent and effective way of working. And what I mean by that also, what I mean by that is to say that it's health professionals as well as patients themselves by having a sense of control in relating to approaching different aspects of healthcare and healthcare services as providers and service users. Now, despite overwhelming evidence, people with long-term conditions or a disability face several challenges regarding discrimination and or ignorance. People may feel disenfranchised, for example, and have perceptions of helplessness and feelings of powerlessness against the backdrop of diminished health. Now, in context of that, I'm now going to talk a little bit about healthcare and the National Health Service. So, a little bit around population health to begin with in this context. So, it was announced in around 2003. The term population health was used to describe health outcomes surrounding disease trajectories across health conditions and different health conditions. Population health has now sort of progressed to include identifying people at risk of long-term conditions according to severity of illness, demographics, and broader bioinformatic parameters to identify risk in leveraging resources to improve healthcare and outcomes. So, in context with population health and sort of the backdrop of this work around health inequalities, the collaborators looked at this work from a sort of a healthcare education prompt, and so I'm going to talk a little bit about that. So, healthcare education has diversified for patients with long-term conditions over the past 2 decades, and there are several papers or publications that relate to that. Patients with long-term conditions sort of use the internet to access peer support groups through social media, for example. And whilst this can be helpful, peer support alone do not or does not override the necessity for educational support. It is in this context patients either become more informed as decision makers or misinformed around disease trajectory, leading to compromised quality of care. Now, in context with both population health and healthcare education, I'm now going to talk a little bit about. I'm going to talk a little bit in context that relates to sort of online spaces and portals. Now, when I say online spaces, generally I'm referring to sort of social media social media platforms, but also sort of those websites that are available in the public and in the public domain, um, and not so much where reference is being made to technology. It's more to do with sort of website spaces and sort of social media platforms, and internet and the use of the internet. So online spaces have allowed patients with long-term conditions to access um, supplementary information or education relating to health and disease, including the National Health Service, and the National Health Service has its own website, and also through portals. Now, in addition to patient-based organizations and various other sources. Now, the current concern is that despite the advances that have been made in relating to some aspects around technology, integration between information searching versus knowledge implementation differs between age groups and across long-term conditions. Information available over the internet is vast, and much of it can be daunting and lead to educational barriers. The problems which appear in healthcare have risen from a lack of understanding about the multi-dimensional nature of what is known as, or what has been referred to, at least from the United Kingdom perspective, what is known as patient and public involvement. So I'm now going to talk about some aspects that relate to shared decision making, challenging inequality, and some and I'm going to highlight some conclusions and a summary in this work. But I will highlight a few resources as well. So information communications and technology, or also known in abbreviation, information communications technology, is ICT. Now, reducing people's dependence on health professionals and increasing a sense of control and well-being is, as mentioned, is a more intelligent and an effective way of developing sort of joined up thinking between patients and all health professionals. Now, there are a wide range or broad range of initiatives to support self-management, including including information leaflets, online peer support, one-to-one counseling, for example, group education sessions, use of social media, and and again, sort of those some other sort of self management interventions. So initiatives can be characterized along a continuum with passive information provision, and about people's conditions, and sort of the technical skills at one end, and initiatives that more actively seek to support patients, as well as healthcare professionals, and increase self-efficacy at the other end of that continuum. Now, in context of ICT, or information communications technology, there is sort of a link with what's been referred to as shared decision making. So shared decision making is reducing people's dependence, reducing people's dependence on health professionals alone, should allow patients and health professionals who, for example, look to be more multidisciplinary, for example, is an effective way of service providers and service users working more sort of effectively. And there are initiatives out there that are looking and seeking to bridge those efforts. So in doing so, this then prompts and encourages both the patients, carers, and health professionals to not just have a sort of a sense of joined up thinking, but actually on both sides there's more informed decision making across different aspects of healthcare. Now, in context with that, I'm now going to talk a little bit about or highlight a little bit about challenging inequality. Now, the involvement of citizens in decision about health policy, planning, and service provision have been introduced in several countries, including the United Kingdom, Canada, Holland, and Australia. There is a publication that highlights some context in relating to health or healthcare policy, and I will highlight a few resources at the end of this. The public involvement and support are needed or are required to promote to promote areas around and surrounding healthcare research. The research needs to reflect public intrigue and the values. In line with research and challenging aspects that encourage inequality, patient and public involvement, or PPI, has become a key component in the United Kingdom, or particularly in the United Kingdom. PPI gives health service users the opportunity to be part of a solution to establish beneficial healthcare and taking inequity through research. PPI gives healthcare service users the opportunity to be part of the solution to establish beneficial healthcare and tackling inequity through research and involvement. PPI is also an important mechanism for inducing necessary healthcare through research and allows to improve the quality of healthcare. And the essential changes are the belief that involving patients and health professionals in healthcare leads to improving quality of healthcare through what is known as participation or active participation. PPI, or patient and public involvement, also helps in bridging gaps between healthcare professionals that might be on healthcare professionals that are frontline and health professionals that work sort of behind areas in health practices, and of course patients themselves. The involving of patients in healthcare is an ethical requirement, since patients pay for services, so they should have an influence on healthcare together with health professionals and across different areas and focuses, including the sciences. I'm now going to highlight some conclusions around this work and some summary. And again, the full works is available through the Renal Patient Support Group, the RPSG. So those listening in are welcome to check out the works through that way. So some conclusions. Patients are the intermediaries between health sectors. So again, between primary and secondary healthcare services. Now, chronic kidney disease patients, in particular, sort of have more opportunities to have shared to share lived experiences owing to the nature and implementation of particular social media platforms. So, for example, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for kids. Now, in addition to sharing experiences, this prompts patients to be more than mere recipients of healthcare. Chronic kidney disease patients become more empowered so that more informed decisions can be made. Now, a little bit around this in context of summary. So, educational sort of intercessions are sort of required generally to offset issues where there are inequalities, but also to ensure excellence in health practice. Patients would welcome health professional involvement through online platforms. The above notwithstanding, sort of future research should look to encourage the involvement and development of sort of a novel framework, sort of to help streamline educational support and highlight what CKD, chronic kidney disease education in healthcare could or should look like, with healthcare professional involvement to bridge health inequalities through social media platforms, for example, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARs for kids. So generally, one of the main take-home points in this is that collaborations across industry are required to bridge practice excellence. And as I said, I am going to highlight a few resources that can be referred to, and so, for example, there is a framework or a main guideline from the Department of Health that was published a little while ago, but it's still quite a good overview, provides a good overview, and that's the Department of Health document in 2012, and it's a document that relates long-term conditions and as a compendium of information, and it's available through the Department of Health. There's works by Mohammed and team from 2020, and where they look at the role of different healthcare professionals, in different healthcare professionals in and around educational support and surrounding healthcare requirements for patients suffering with chronic kidney disease. And it's a paper publication. It's available through the Renal Patient Support Group, the RPSG, and it was a peer-reviewed publication in a peer-reviewed scientific journal, and there is works also by there are works by Mohammed and team from 2014 as well, where they look at the renal patient support group, the RPSG, and it's highlighted works around supporting patients with chronic kidney disease through social media. So it was one of the sort of preliminary publications that came out from the renal patient support group, the RPSG, in 2000 in 2014, and so the works again are available through the renal patient support group, the RPSG. Feel free to check out the works through the organization, through the RPSG. And again, in this series, in this audio podcast series, there will be a few other sort of overviews in relating to aspects that relate to sort of healthcare, sort of inequalities and equity. So I'm going to draw this audio podcast to a close. Thank you for taking the time to check it out. This has been The Shientist, and in this audio podcast series on the Shientist Intermission, and this audio podcast was on health inequalities as part of a Storm Robotics production. Thank you for taking the time.